Now, charity is warning that public health could be at risk because GP surgeries are refusing to register asylum seekers. Doctors of the World says almost 40% of patients it's tried to register have been turned away. Well, let's talk to Dr Emma Preston, a volunteer GP at Bethnal Green Doctors of the World Clinic. Good morning.
Good morning. Hello.
What is the reason then that people are being turned away?
Well, I think it's mainly to do with lack of knowledge amongst frontline staff, in the fact that all people are entitled to primary care regardless of whether you have documents or a passport or anything else like that, or proof of address. So it's purely, there just needs to be more awareness amongst frontline staff and receptionists and GP surgeries that anyone's entitled to primary care.
Do we need to view this not only as an issue for these particular people, which clearly it is, but in terms of wider public health, if people aren't getting the medical assistance they need?
Well, I think let's just be clear, it's not just refugees, it's anybody without a proof of address. So, for example, homeless people, various vulnerable adults in society. Public health is obviously one thing to think about, but it's also people's personal health as well.
So essentially it is just a problem with paperwork and that not being processed or not being available as easily as it should be.
Yes, exactly.
I mean, there is perhaps the perception with these sort of figures that some surgeries are not wanting to take on people where they perceive there could be, you know, ongoing health issues or putting extra strain on an already understrained practice. Is there any evidence to suggest that it is happening? No,
there's not evidence on that front. As I say, it is purely to do with paperwork, lack of addresses and passports, being a barrier to people being able to register with GP surgeries when they shouldn't be.
But people who find themselves in that position for whatever reason, what can they do to access healthcare?
So I think, I mean, they can access a mainstream GP surgery. It's just that GP surgeries need to realise that these people can register and they don't need a proof of address and passports.
But if they're being turned away, what do they do?
Yeah, so, well, I work for a charity called Doctors of the World, and we assist people who haven't been able to register at mainline surgeries and try and you know, provide them with the care they need. Unfortunately, some people may access A&E or inappropriate services if they weren't able to register with a GP. So I think it just highlights, you know, we all need to work together to make sure frontline staff and GP surgeries are made aware that anybody should be able to access primary care.
And you're working at Bethnal Green in East London. I mean, is that an area where you're seeing actually a lot of strain, a lot of pressure on what is a volunteer service?
Yes, I mean, it's a busy clinic. You know, obviously primary care in general is under a lot of strain and pressure, as we know. So it's not just within this clinic; it's generally within primary care.
But if somebody is boxed into a corner and they are desperate, they could contact Doctors of the World to access care.
Yes, exactly, and we'd assist them. And our priority is, you know, obviously treating patients, but also registering them with mainline GP services.
Okay. Dr Preston, thank you for being here this morning.
It's a pleasure, thank you.